Hello, and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. Coming up on the podcast today, I'm talking to Tim Gardner, who's the Assistant Director of Policy at the Health Foundation think tank, about what a new Labour government could mean for the NHS. We'll be discussing Labour's plans to shift a greater share of NHS funding to primary care and what that could mean for general practice, what the government needs to do to bring down the NHS waiting list, and whether it can do anything to avert collective action by GPs. Tim also explains where the new government might look to for quick wins on the NHS to show progress in its first 100 days, what improvements could be delivered through reform alone, and whether Labour's spending plans that it set out during the election will add up to make the changes that are needed to the health service. I'm delighted to be joined on the podcast now by Tim Gardner, who's Assistant Director of Policy at the Health Foundation think tank, to talk about what the new Labour government could mean for the NHS. Before he joined the Health Foundation, Tim spent over 10 years at the Department of Health and Social Care working on policy, and before that, NHS performance. He's also worked at NHS England. Thank you so much for coming on the podcast, Tim.
Thanks, Emma. Great to be here.
So, obviously, new Labour government. This week, we've seen the new Health and Social Care Secretary, Wes Streeting, commit to one of Labour's manifesto pledges, which was to increase the share of NHS funding going to general practice and primary care, although he's not really given any details at all about how this will work. This is something the Health Foundation has also called for in the past. How quickly do you think we might see progress on that?
So I think this is going to be pretty challenging to achieve. It's worth saying that general practice plays an incredibly important role in the NHS as a first point of contact for patients, as the way people access secondary care, and as a way to provide continuity and coordination of care. We're absolutely convinced of the need for increasing funding in primary care. We think it's really important. It's really well known that the UK has an ageing population, but some of our analysis has revealed that by 2040, we're also expecting to have quite a large increase in the number of people living with a major illness. So type 2 diabetes, chronic pain, or living with depression and anxiety. And we'll also have more people who'll be living with multiple long-term conditions. So primary care is where most of these conditions will need to be managed most of the time. But general practice is under enormous pressure. The NHS has become increasingly hospital-centric over the last 14 years. Hospitals are consuming a greater share of the NHS budget over the last decade. But to make sure that we've got a health service that's fit to meet our future health needs, we need to invest more in primary care. Now, from our work on public perceptions, we know that there is public support for rebalancing of where the NHS's resources go. But we shouldn't underestimate just how hard this is going to be to pull off without significant additional funding going into the system. No part of the system is having an easy time of things right now. Successive governments have set out plans and priorities for shifting services out of hospital and more towards the community, but have largely failed to do so, and the system's become increasingly hospital-focused over time.
The BMA have written to Wes Streeting and they've said they want to see a 1% year-on-year increase in the share of the NHS budgets that's going to general practice until it hits 15%. Can we really realistically think about general practice receiving 15% of the NHS budget?
It's a great question. I mean, I think it's pretty clear that the proportion of the NHS's budget that goes on general practice does need to increase. We're coming off a decade in which spending on hospitals has outpaced spending on primary care. I think that has to go in relatively gradually. It has to be accompanied by attention on the infrastructure that you use to support general practice as well. So clinical commissioning groups used to play a really important role in supporting GP practices, and it's unclear how much of that capacity and expertise has transferred over to the new integrated care boards. You know, if you're going to have more money going into general practice, then that needs to be accompanied by the right support for implementation and transformation in general practice in order to spend that money well and make that transition a real success. The risk is that money does not get well spent and might undermine otherwise quite well designed policies. It's also about more than the total quantity of money that's going in. So we know that there are quite long-standing disparities between the funding of GP surgeries in richer and poorer areas when we take into account health needs. We know that working in general practice can be incredibly difficult, so we need to see more action to retain GPs. We also need to pay attention to getting the right mix of staff. And so that could well include thinking about how to better capitalise on the massive expansion of direct patient care staff in general practice, which has boosted appointment numbers, but it hasn't resulted in improved patient satisfaction, and it may have impacted on continuity of care. So I think there's definitely more money needed, but I think also attention to the workforce and how we make sure that money is well spent on improving services.
When I was speaking to Wes Streeting a couple of weeks ago on the podcast ahead of the general election, he said he was hopeful that he could persuade GPs against taking collective action. We know that that's on the cards, could happen this summer. What do you think the new government can do to avoid it coming to that?
So I think there are a few areas they should be focusing on. So one is we do need to see more money going into general practice over time. So being able to put more funding into, or commit to putting more funding into general practice is going to be a good move. Thinking about how to improve the working lives of general practitioners, I think is also going to be another big part of this, and thinking about how to support them in their daily lives, and running practices and delivering services to the public will be really key. But I think there's also something around what not to do. So in opposition, Labour did talk a little bit about new structures for general practice, but I think avoiding being overly prescriptive with what those might be is quite important. Form needs to follow function. So government needs to make sure it's clear on what general practice is really for, and then work on designing and supporting organisational forms that meet those functions. Avoiding talk of wholesale reorganisation, setting quite clunky access targets to general practice. Those often backfire. Under the last Labour government, we saw the target to guarantee an appointment within 24 or 48 hours, which was met, but saw patient satisfaction go down. And I think just generally staying clear of some of the damaging rhetoric we've heard from politicians sometimes that has fueled workforce challenges and often demoralised GPs.
No major reforms would be welcomed by most people who work in the NHS, wouldn't it? One of the other things, obviously, that Labour's talked about quite a lot when it comes to general practice is bringing back the family doctor, continuity of care. Do you think that's something the government will be able to achieve, and how do you think it's going to go about doing that?
Continuity of care is clearly really, really important. There is a pretty good and solid evidence base showing that continuity of relationships in primary care is more satisfying for GPs, gives a better experience for patients, and can actually lead to improved quality of care for patients with certain conditions as well, with benefits including fewer admissions for certain conditions. So that's pretty clear. So there's a pretty strong case for any government looking to improve continuity. But actually how you do it is another question entirely. Now that's especially complicated by the fact that the system is operating under such extraordinary pressure at the moment. Patients are really struggling more than they have been in recent years to get appointments when they need them, to see the right professional when they need them. Equally, the move to expand the clinical team that work in general practice, so making use of more clinical pharmacists, paramedics, physiotherapists, that rather complicates things again. I think if the government is going to stand a chance at doing this in a meaningful way, they're probably going to have to think about who to prioritise for those efforts to improve continuity of care for, which is not straightforward. With the right investment in practice systems and support for implementation, I think also some flexibility, some local flexibility for practices in terms of who they are thinking that continuity needs to be priority for. So, last government did try and experiment with providing a named accountable GP for every patient who was aged over 75. That policy was implemented, but I think the impact was no increase in continuity at all, simply because there just weren't the systems there to match relevant patients and make sure they got the appointment with their named accountable GP. So there is something quite tricky to pull off there. And actually who is going to benefit most from that continuity is going to vary from practice to practice.
Labour was clear during the manifesto that one of its overall priorities was to bring down the waiting list, and that is a big driver of workload in primary care as well. Do you think they're going to be able to make any progress on doing this based on what they've said during the general election campaign?
The elective waiting list in England has already come down from a peak of about 7.8 million last autumn. There has been a bit of further progress over the last few months, albeit rather more slowly than I think we'd like to see. Fundamentally, the way that you tackle a waiting list backlog is by treating more patients more quickly. In the short term, that means getting more activity out of existing capacity. Labour has already set out some plans that are aimed at doing exactly that. And that includes things like paying more overtime for weekend working or for additional shifts, using the private healthcare sector more. And they've also talked about some particular productivity enhancing interventions. That should enable some further progress in the short term. In the longer term, though, making further sustained progress on getting waiting lists down, and then once they are low, keeping waiting times low for the foreseeable future, does mean investment in expanding capacity within the system. So that means making sure the NHS budget keeps up with underlying demand, which is growing. It means addressing very long-standing staff shortages. And it also means investing in modernising buildings, equipment and technology. Now, that's where Labour's plans are rather less well-defined at the moment. I think it also illustrates quite a big dilemma that's going to be facing the new government. They've set themselves some very ambitious goals to meet hospital waiting time standards in the NHS Constitution by the end of the Parliament. That's not going to be easy in any of the areas that covers, including elective care, but it's possible if that's made pretty much the sole focus of the NHS. But as we've talked about earlier, Labour also has quite big ambitions to shift more funding into primary care. It's also wanting to stick to existing spending plans. Understanding how it can do all of that at the same time is not straightforward.
I hate to say this in July, but we're heading back towards winter again. Obviously, it would be quite a disaster for the new government to be seeing sort of stories and images like we saw last winter of ambulances queuing outside of hospitals, people being treated in corridors. Do you think things are likely to be better this year than in the last couple of years we've seen?
Well, I think it's always hard to make predictions about winter. How bad a winter the NHS has in 2024 is going to depend on some pretty big factors that are going to be outside of government's control. So that's going to include the severity of seasonal flu, whether we get any major outbreaks of other seasonal bugs and nasties. And it'll also depend on the weather. So how cold is it going to get? How prolonged are any cold snaps going to be? So that's not to say that the government and the NHS don't have any influence over winter. And new health ministers should definitely make starting to prepare for winter a very early priority for action and investment. And July is definitely not too soon to start, especially given the horrible weather that we've been having in recent days. A very big part of those preparations should be improving hospital discharges and reducing delays. So every day, around 12,000 patients are stuck in acute hospital beds that they don't strictly need to be in, but other patients are waiting for. This seems to be a big bottleneck at the moment for the NHS. It involves acute hospital capacity in community-based services, and also in adult social care. Now, during the election campaign, Labour did talk a bit about buying extra social care beds. That was criticised at the time for being a little bit simplistic. There is definitely scope for taking a sensible approach to using any winter funding this year. If we allow local areas the flexibility to fund the extra capacity that best aligns to the needs of their patients, where that capacity is actually available, and also making sure that wider support is available, so we're not just shifting the problem from one place to another, that could make a real difference. But overall, making sure that winter pressures don't regularly tip into winter crisis is probably going to need longer term action. What we're going to need to see is work to expand capacity in hospitals and community-based services, and also make improvements in how patients flow into, through and out of hospital. And that's entirely possible. In fact, under the last Labour government, under the first few years of the coalition government, we hardly heard anything about winter pressures. They are, or winter crises, definitely. They're definitely not inevitable. but it's going to take more time than the few months that the new government has to make that happen. So how bad the winter will be, difficult to say, and possibly outside of the government's control. It could be a tough one, but there are definitely ways to make that better or worse.
The new government is going to want to make progress on some issues quite quickly. They'll want to have something to show for those first 100 days in office. What areas do you think they might look at for quick wins in the NHS? Do you think we could see some sort of deal with the junior doctors? Obviously, they're talking to them this week about the pay dispute.
So I think you're right that they will look to try to show signs of rapid progress. Coming up with a deal with the junior doctors is going to be a really strong early priority. Likewise, heading off industrial action by GPs will be a similarly high priority as well. More widely, what's come out of the government over the last few days, it looks as if Wes Streeting, as new Secretary of State, is looking to try and really strongly manage public expectations about just how much the new government is going to be able to deliver. So he's talked about the NHS being broken, etc., etc. There's also some interesting reports that have been coming out about possible review of trying to understand just how bad things are in terms of NHS performance and finances. In terms of expectations management and the politics, this is probably quite a good move. Our recent deliberative research with the public found that when we presented some of our analysis looking at the outlook for the NHS, people were really shocked how much of a hole the NHS is in and how long it could take to bring about meaningful improvements. So that's the sort of approach that could help to buy time for developing a proper plan for bringing about improvements. But for any government, they'll come in with some very strong plans, I'm sure, for their first 100 days. But there'll also be a host of long-standing and legacy issues that the new government needs to deal with. That's going to be some unfinished business from the last government. So some things that will have to be high up on the agenda will be compensation arrangements from the infected blood inquiry. I think they'll have to respond to the upcoming first result report from the COVID-19 inquiry. There'll be NHS trust deficits. We've already spoken about winter. They'll have to start thinking about plans for social care reform. Might want to watch out for reviving some of the last government's smoke-free generation legislation in the King's speech next week. There'll be a whole range of issues that I'm sure we'll start seeing as those first 100 days play out.
The government has talked about having a new sort of 10-year plan for the NHS. What do you think they need to look at as part of that?
I mean, I think it's worth looking back at what is the NHS's current 10-year plan. So this was 2019's NHS long-term plan. And when we look at the sort of core principles of that plan, I think they're still broadly the right ones. So much greater focus on primary care and community health services. The NHS doing more on prevention. And it also wanted to see more action around inequalities in access to experience of and outcomes from NHS services. So those are still, as a set of core priorities, probably the right ones for the NHS. I mean, progress over the last 5 years in delivering that plan was clearly quite heavily disrupted by the pandemic. It's also thrown up a set of new pressures and priorities which would need to be taken into account. So waiting list backlogs and elective care. There's also probably more need for mental health services, particularly for children and young people. And we've seen more alcohol abuse in the last few years since the pandemic as well. So clearly that plan needs a big refresh and an update. Equally, we don't need to reinvent the wheel. We don't need a year zero approach to health policy. I think what we do need to see, though, is, as well as an updated plan, is a much clearer focus on how you make some of those changes happen in practice. So I think what I'd like to see is a refreshed plan, but with probably less focus on the what, in terms of commitments that are made in that plan, and rather more about how we're actually going to make those happen.
One of the things we've sort of touched on in this conversation is money. Labour was quite conservative in its manifesto when it came to pledges on funding. Analysis that the Health Foundation's Real Centre carried out during the campaign found that NHS funding could fall £38 billion short of the level needed to meet rising demand and deliver key improvements over the course of this next Parliament. Labour's spending commitments in the manifesto came nowhere near to that. What are your thoughts about what this will mean over the next 5 years?
So Labour's coming into office after a very long period of austerity for the wider public sector, not just the health service. While the NHS budget has been protected in real terms, other services have experienced substantial real terms cuts. So thinking of local government in particular. Labour's been pretty clear that it's not looking at more funding as being the answer. I think in political terms that's understandable given the range of other demands it's going to face. But it's also true that we know demand for healthcare is growing. It's hard to see how Labour could achieve all of its ambitions without finding a way to invest more in the NHS. On the funding point, we know that the public are actually a bit more ambitious than many of the politicians we heard from during the campaign. When we've done deliberative work with members of the public and we've looked at this question of whether the NHS should get more funding, even if that means tax rises in some form, actually the public are pretty solidly in favour of that. We even went to the extent of giving people an illustration of what that might mean for increasing income tax or national insurance or VAT and how it might impact people like them. And, people are not desperate to pay extra taxes, but neither are they particularly happy with the state of the health service. So they overall did prefer to see taxes go up if that meant more money going into the health service. Some of the sums that we're talking about, £38 billion seems like an imaginably large amount of money. And it is a huge amount of money. This is the sort of amount in real terms that we think would be needed by the end of the Parliament. But it's not unthinkable either to put that into funding growth. It's roughly in line with the historic funding growth that the health service has had on average throughout its 76-year history now. It would not be the most generous funding settlement in the history of the health service by any means. In terms of international comparisons, delivering on that would probably get the UK to where France is now, but in 5 years' time. So it's not exactly unimaginable either.
One of the things that Wes Streeting, I've heard him say several times during the election campaign, very keen to talk about reform being the answer to the problems facing the NHS. He's suggesting that we can deliver a lot of the improvements we need just through reform. Can we improve the NHS just on reform alone, do you think?
Fixing the NHS is definitely going to be about more than money. So it's understandable to hear the government talk a lot about reform. But I think what we need is a combination of the two. It's got to be investment plus reform rather than one or the other. Throughout the 76-year history of the NHS, its budget has always risen in real terms year on year by an average of just under 4% in real terms. This is not something that is unique to this country. We see a very similar picture in virtually every other high-income country, largely driven by the same drivers. So the fact that, healthcare is able to offer more and more benefits to us as individual patients, and as populations, we're generally willing to pay more to get those benefits. So we do need to see more investment going in, but equally, it is about more than money, and we do need to think carefully about how that's spent. So thinking carefully about what are the small set of national ambitions that the government wants to achieve, which might involve making some difficult choices about what not to focus on, and then aligning different policy levers behind those ambitions. For example, making sure that things like national targets, financial incentives, the way the money flows around the system more widely, how integrated care boards and providers are overseen and regulated, and the practical support that's available to help with transforming services locally, make sure all of those things are pointing in the same direction and are entirely complementary. That would go a long way. Equally, having some clarity over the longer term direction of priorities could be really impactful. So having a clear sense for the health service of stability, consistency of purpose, and more certainty over funding, even if funding isn't going to increase substantially, those things would all help, even without large amounts of additional funding. The only thing I would add to that is probably to keep integrated care systems I'm not suggesting that these don't have their issues and haven't done since they were formally established in 2022. But I think it's probably far better to find ways of working within those existing structures than waste 3 years by restructuring. The key, though, will be trying to make sure that ICSs are held accountable for a wider set of ambitions, thinking beyond hospital waiting times to the wider range of what we would expect those systems to be delivering.
One of the other things that Wes Streeting has said as well, he's very keen on this idea of rolling out the best that he sees in the NHS, the best things that happen in the NHS, trying to get them taken up more widely. So pilots that are shown to be doing well. But this is something that successive governments have said, and people are always keen to do this. And I personally have come across cases where people have done amazing work, which would have made a difference if it had been able to be rolled out across the NHS. But somehow this just never seems to happen. Can they actually do this when previous ministers, NHS England, other leaders have not been able to make it happen?
So I'd be optimistic, and I'd say yes, we can, but we probably need to change the way we think about pilots. So there's definitely a sense of kind of we've been here before. I think where this often goes wrong is when national policymakers assume that once we know what works in one part of the health service, all we need to do is to just tell everywhere else to just get on with it. But change is often quite a lot more complicated than that. Very often we see government or NHS England establish a new programme of Pathfinders, pilots or trailblazers or various other names. Now those interventions tend to focus on organisations or systems that are already performing to a relatively high level. Now, those systems tend to be better placed to make them work, and they tend to benefit from getting the available resources. And resources tend to be concentrated on the pilots, because piloting something and making it work is assumed to be the really difficult bit. But at the Health Foundation, we know from a lot of our improvement work that spreading innovations and that encouraging wider adoption, even of really quite well proven innovations, is a lot harder, and it involves a lot of hard work that needs to happen right across the system. So taking an intervention that has been designed and proven in one context and then making it work in a range of other quite different contexts is not the work of a moment. So I think what we really do need is, the system needs to understand an intervention, but it also needs to understand how to adapt that intervention to very different contexts. And the time, skills and support needed to do that are often underrated. So rather than just supporting innovation and service change when it's at the cutting edge, we need more support for adoption and for spread. And then we might see some more of that wider rollout of innovation.
One of the other big things that Labour's talked about, and I think Wes Streeting has said something about that this week as well, is about the importance of prevention. Now, prevention seemed to be quite high up in almost every election manifesto that I looked at this year. But we often find that prevention, public health in particular, is kind of left by government because you don't see the benefits of it within the 5-year term of a government. Do you have any thoughts on what Labour is likely to do on public health, and what would the Health Foundation and what would you like the government to be focusing on?
So I think if we start with health and care services, I think one of the things we need to see government doing is actively reorienting health and care services towards prevention. Now, that means increasing the share of funding that's going to primary, community and preventative services. It's also going to need a long-term approach to investing in prevention. That's one of the reasons why in our funding projections, we included an assumption about restoring the value of the public health grant that goes to local authorities. Local government plays a really key role in ensuring the health and well-being of local populations. Beyond that, I think in terms of government action, we'd like to see more population-level approaches to some of the leading risk factors of avoidable ill health. An early priority for us, for the new government, would be to revive the last government's smoke-free generation legislation, which fell when the election was called. So getting that back on track and through Parliament would be a really strong early sign. I think this was something that Labour were talking about during the election campaign. It would also be really good to see them commit to some wider population level approaches to reducing harmful alcohol use, thinking about restricting promotions of unhealthy food and promoting more physical activity. Now, what we saw under the last government was very much a focus on the individual as taking responsibility for some of those things and trying to empower the individual. And that's where their focus was very much skewed. There is a place for interventions like that, but equally, if you combine those with population level approaches, then more regulation, more focus on supporting local authorities to fulfill their role, we could probably look to see faster progress in this. And then the really big picture here is thinking about the wider building blocks of health. So housing, employment, and particularly in the most deprived parts of the UK, some urgent action to tackle poverty could really go a very long way and should have beneficial effects for the health service as well as for the health of the population as a whole.
That was brilliant. Thank you so much, Tim. Thanks for your time.
Thanks for having me, Emma. Great to speak to you.
Well, that's it for this week. Thanks for listening, and thanks so much to Tim for taking the time to talk with me. You can read more about what the new government has had to say about general practice during its first week in charge in the news section on our website at GPonline.com. I'll be back next week when I'm speaking to Dr. Emma Ryan, the Royal College of GP's clinical champion for gambling harms, about the role general practice can play in tackling this issue. So please do join me then.